Hello, everyone. This is Francine Crawford. I'm here on Autumn is Here. We're here to talk to Miss Paula Rice, and we're going to talk about Alzheimer's in the African-American community. So let's welcome her to the show. Hello, how are you doing today?
I'm well. Thank you. How are you?
I'm good. Thank you so much for taking the time to speak to us on Autumn is Here. We know that how important it is for us to get information out to our community. And Alzheimer's is a big subject, and I don't think a lot of us know details about it. We may have heard it and heard the word and the terms, but do not know a lot about the details.
Yes.
So first, tell me just a little bit about yourself.
Okay, so I got involved. I guess I consider myself an advocate for Alzheimer's disease in the African-American community. I got involved as a result of being a caregiver for a mother who had dementia. And it was like a 10-year journey. It was very difficult. It was, it was heartbreaking. It was just tough. It took over my life. Sometimes I felt like a little resentful, and then guilty for feeling resentful because it was my mom and I had a wonderful mother. And there was no question in my mind that I wasn't going to, make sure that she had the best of care possible. And then after that journey, because I had been so involved with the Alzheimer's Association that I became, after my mom passed away, I became a volunteer. And then after that, after volunteering for a few months, they asked me if I wanted to be their manager of African-American outreach for the community. And so I did that for like almost 10 years.
Wow.
Yeah. So it's just like been really like part of my life now. It's just an integral part of my life. And while I was involved with the Alzheimer's Association, I partnered with Columbia University to educate the community, not just about Alzheimer's, but also about research studies that were going on. And they offered me a position as their community engagement officer. And so that's what I do now. But it's still all about educating the community about this disease, how to get help, how to survive it, as being a caregiver, and then how to give back as well.
Right. So let's first start about just explaining about Alzheimer's and the actual disease.
So it's a disease it's a neurological disease. Mm-hmm. It destroys our memory and our cognition. And a lot of people don't realize, a lot of people think that it's a mental illness or it's schizophrenia or, bipolar disease, but it's something physical. Actually, something physical is going on in our brains. They're shrinking. We're losing brain cells and brain mass. And so the brain is shrinking, and that's where the loss and the lack of memory comes from. So when if the doctor does a PET scan of the brain, you can see it. You can see gaping holes in the brain where brain cells have actually atrophied and have died. So there's nothing there. There's just there's a hole where, all your brain cells that held your memory, memories of your life and what's going on in front of you and all of that. It's gone. So, and it's really important to understand, the pathology of the disease so that you can understand what the person is going through.
So a lot of times people refer to dementia. Dementia is an overall umbrella.
Right.
Right. And Alzheimer's falls under that. Can you explain a little bit about dementia, memory loss, and the other?
Yes. So a lot of times, I think, unfortunately, sometimes doctors will say, oh, well, your mother's getting old, so, she's forgetting and she's getting a little dementia. And I tell, clients that that's not an adequate explanation or diagnosis,
Right.
what type of dementia. So because dementia is an umbrella term and there are different types of dementias, it's like, think of it as cancer. There's different types of cancer,
Right.
and different causes for it. So dementia is just when you start losing your memory and your cognition. But there are different things that cause it. And so it's really important to know what the cause of the dementia is, the forgetfulness. So there's Alzheimer's dementia, there's vascular dementia, there's frontal temporal dementia, and Lewy body dementia. Those are the most common forms of dementia. Alzheimer's is the most common form of dementia, and then vascular dementia is next. And I think, some celebrities have brought, I think Bruce Willis, they're talking about his frontal temporal dementia. The most common forms of dementia is Alzheimer's dementia. And Alzheimer's dementia is caused by a protein called amyloid beta that starts clumping on the brain, and it suffocates the brain cells, and they die. So that's the most common form of dementia. It causes a plaque, in the brain. And then vascular dementia is the second most common form of dementia, and it's caused by their technical name is ischemic strokes. And I think people refer to them as like mini strokes or silent strokes. And what happens is you have these little strokes and you have no symptoms. So what happens is that maybe you have a tiny, tiny little blood clot in your bloodstream, or maybe several, and what happens is they block the blood flow of a blood vessel in the brain. And so for maybe 12 hours, 24 hours, maybe even 48 hours, the brain doesn't get any blood flow. And if it doesn't get the blood flow, it's not getting oxygen, and it needs oxygen to survive. But eventually the force of the blood flow pushes it through, and then everything goes back to normal. So you just had a little for 24 hours, you had a little stroke, and you weren't even aware of it. And this can go on for, and it's important that's why, getting a diagnosis and getting a regular checkup is so important, because that's the only way you're going to know if this is happening.
Right.
So that's vascular dementia. So we just need to be, aware of and informed so that we can advocate for ourselves and ask questions. That's my main concern. That's what I advocate for, to like Google everything, and when the doctor says something, pull out your phone and Google it and ask them, well, what does this, what does this mean?
Ask questions. Yeah.
Ask questions. Or what do you mean dementia? It says here that dementia is an umbrella term, and there's 4 or 5 different types of dementia. What type of dementia does my mother have, or my father, or my husband, or whatever? What type of dementia? And how are we going to treat this? So and there are medications out there, and so it's important that you request an examination.
Right.
Yeah.
What are some of the early signs of Alzheimer's? How would you know? How would you recognize?
So, the thing about it is like people with dementia in the early stage, they're pretty savvy. They're like pretty smart. So they can come up with excuses for their behavior that makes you think, well, maybe, that sounds reasonable,
Yeah.
So maybe maybe this isn't, and maybe they're just getting old and forgetting things. But, your loved one, and if they're acting out of character. And it really is important to insist that they get a neurological, examination. And you really have to kind of push for it. My mom had vascular dementia, and she had had a series of those silent strokes, and she had never had any symptoms, but then she was starting to have accidents in the car, like her spatial, she was having spatial confusion. So like, you know, if she were in traffic, if she were supposed to stop, she would accelerate. Or if she was supposed to accelerate, she would stop and then someone would hit her. So she was starting to have accidents in the car. And she was starting to repeat herself. So repetition of speech, saying the same things over and over again. Confusion of dates and times, like, you know, showing up to church on a Wednesday when it's not, thinking it's Sunday, you know, misplacing things. And then because you can't remember where you put them, you start accusing other people of taking them. And then, and then paranoia might creep in. A person, you know, their little sweet adoring mother may become like this, I shouldn't say monster, but, you know, they may curse and, you know, become mean and agitated and, you know, and argue and argumentative and, you know, just a completely different individual. Their personalities change almost. It's difficult. It's very subtle in the early stages. You know, the symptoms are very subtle and it's difficult to, you know, really recognize that there's something going on.
So you mentioned early stages. So let's talk about early stages and early onset and late onset Alzheimer's.
Okay, so, well, early onset is, when I say early stages, that generally applies to someone who's in late onset, like in their 60s, because the early onset is genetic. And people who get Alzheimer's or some form of dementia in their 50s, you know, they may get it in their even late 40s or 50s. So that's usually genetic, and you can get a blood test for that. And if you have a gene on your 21st chromosome, which is the Down syndrome chromosome, and you can be tested for that. They almost like 99%, it can be 99% sure that this individual will get the disease. You know, so that's like early onset. Late onset is just like age related. Like the older you get, your chances of developing dementia increase. So maybe when you're in your 60s, you have a 1 in 10 chance of getting the disease. And then when you're in the 80s and 90s, you may have a 1 in 2 chance of getting the disease.
How does Alzheimer's affect the African-American community?
So the risk factors are, and these are risk factors for everyone, diabetes, hypertension, heart disease, and let's see, I mentioned all of them, and diabetes, heart disease, hypertension, and stroke. So those are the risk factors, and obesity too. Those are the risk factors for everyone. But African Americans have a disproportionately higher rates of those diseases. So we have higher rates of diabetes and higher rates of hypertension, higher rates of heart disease, you know. So, and that's what the research, you know, part of the research that I'm involved in is they're looking for, you know, the genetic reasons for why do we have higher rates of these diseases? Because that's what puts us at risk. So those are risk factors. The good thing is that though those are manageable. So you're on top of it. You know, if you're obese, you can lose weight. If you have hypertension, you can manage that with medication. If you have diabetes, you can manage that with diet and exercise and medication. So if you're on top of those risk factors, you can lower your risk, your, rate of getting, or delay it, your risk of getting Alzheimer's disease. So it's important just to be healthy. I mean, and that's just, we should be doing that anyway, going to the doctor, being proactive, asking questions, taking our meds. So all that can help. And, exercising and eating healthy, all those things can help lower the risks. So that's a good thing.
Right.
Until we find out, what's causing us to have these higher rates, but genetically, but we can always be proactive. So, so it's good to know. Yeah.
Okay. How do you get a proper diagnosis?
So you really have to ask, sometimes demand, maybe your doctor doesn't, I had to demand from my mother, her primary care diagnosed her with depression and didn't refer her to a neurologist. I had to take it upon myself to find a neurologist and demand that, she be sent to a neurologist. And that's when we discovered that neurologist gave her an MRI and discovered that she had 2 years worth of stroke damage. We had the silent strokes, and silent strokes show up as little white dots on the MRI. So they can almost count them and see how many strokes you had. And if we had caught it when she had just had 1 or 2 strokes, we probably could have prevented her from having full-blown dementia, vascular dementia.
Wow.
So I was really upset about that, because I thought, wow, he's been her doctor for 30 years, and he misdiagnosed her, and he didn't even recommend that she have a neurological evaluation. So you really have to demand, you really have to know these things. And it was, the silent strokes are caused by diabetes, puts you at a higher risk for having these silent strokes. So she was a diabetic. And so I thought, wow, he didn't even check this, So it's really important to just know. And like you said, ask questions.
Yeah.
But the diagnosis should involve a neurologist should conduct it, not just your primary care, but a neurologist who hopefully specializes in memory loss or Alzheimer's or dementia should actually give the person an evaluation. And, part of that is doing a medical, doing a physical exam, taking a medical history and taking a blood test, because there are other diseases. Well, there's 2 other diseases that can cause a person to have memory loss. And one is a low functioning thyroid, and the other is a vitamin B12 deficiency. So, and there's really no test for Alzheimer's. So what they're doing is ruling out other things that could cause you to have memory loss. And a person can have a vitamin B12 deficiency, and that can be detected through a blood test. And the doctor can give you injections of B12 and it will solve it. So if the person is having memory loss, it could be related to the thyroid, and it could be related to B12 deficiency. And so they can give you injections of B12. If it's related to the thyroid, they can give you a thyroid hormone, and that can correct it as well. So, people don't know that.
Right.
So it's just important to be, like I said, to be informed, and for people like you to, realize that this is important information, and we all can learn something from, from someone who's had the experience, or from a doctor or whomever, but it's just important to talk about these things, these experiences.
Yes.
And MRI should be a part of the evaluation. So, the blood work, and psychological test as well.
Okay. So are there medicines that people can use that if it's detected that will slow it down? Because I know it's no cure, but
there's no cure. There's medications that can slow it down. If you're fortunate enough to catch it early, then the medications are more effective. Because like I said, they don't cure it, but they will slow it down to the point where maybe the individual, if they do, they'll die of something else, because the body starts, when the brain is, non-existent or it's deteriorating, the other parts of the body start shutting down.
Right.
So in the end, the person lasts 10, 15, 20 years, something else other than Alzheimer's or dementia, some form of dementia, may, actually kill them, as opposed to the dementia itself, because you slowed down the progression. So, so it's, there are medications out there. There's Aricept, which is the most common form, and that's prescribed in the early stages, and throughout. And, it's interesting because some people, after taking it or giving that Aricept to their loved ones for a period of time, they say, there's really nothing, it's not helping. No. It's not, they're still getting worse. Well, yeah, they are going to get worse because there is no cure. And I've heard doctors say tell their patients that, the only way if it's working is to stop taking it. And then if you stop taking it, then you see a major difference. Then they start really getting worse. And the doctor said, and then once that happens, and if you resume taking the meds, you can never recoup what you've lost. So there's Aricept, there's Exelon, and Exelon comes in a patch. And for people who can't take the Aricept, because sometimes it can cause like diarrhea, or stomach cramps. So Exelon can be the patch. They can use the patch and use that as opposed to the Aricept. And then there's Razidine, and there's Namenda. And sometimes Namenda is a lot of times prescribed in the latter stages of the disease, and sometimes it's prescribed along with the Aricept. And I just want to mention that it's really important to know the medications. Okay. Because sometimes, because people in our community, they wait too long to get a diagnosis. By the time they take their parents or whomever to a neurologist, or sometimes to their primary care even, they may be having symptoms that appear to be schizophrenia. And so like the paranoia and the agitation, acting out, that kind of thing. The primary care might send them to a psychiatrist, and the psychiatrist might prescribe them to say, oh, this person has schizophrenia, and prescribe them with a psychotropic drug. It's really not appropriate for someone who has a neurological disease. So it's really important to know. I think like Seroquel or something is a drug, a psychotropic drug that's given to schizophrenics. But it's really not a drug for someone who has dementia. So it's really important to know what the drugs are,
Why do you think that we, as African Americans in our community, takes so long to go to the doctor or, get help?
Some of the reasons, as in our study, some of the reasons that we cite are just not having, or socioeconomic. Like sometimes people just don't have, they can't go to a specialist. They may not have the health care that will pay for them to go to a neurologist or a specialist,
Mhm.
or they may not have, or they're just not getting the information from their primary care. They're just not being told. They don't know. So it's a combination. It's a combination of things. So, but like I said, sometimes it's socioeconomic. Sometimes, like even I remember during COVID, and you might remember this as well. There were areas like in the outer boroughs, like Queens, where there was no even hospital in the community, where people had to go. They were standing in line, wrapped around the block to try to get into the emergency room to see if they had COVID, because there just weren't enough hospitals
Right.
in the community. So sometimes it's just having the access to the healthcare,
Mhm.
And a lot of times people, they don't go to the doctor on a regular basis, their primary care. They just go to emergency when if there's an emergency,
You notice something. Right.
Yeah, something happens. And so they go to the emergency and they know that they'll, get treated and taken care of. So, they're just, like I said, it's just not a lack of knowledge and awareness. So, and, being a part of a research study too is very important, because a lot of times the drugs aren't really designed for us in mind genetically, so it's just important for us to be part of these studies to make sure that whatever treatment they come up with actually works for us and benefits us. So that's an important part of this equation as well.
Wow. This disease is such it's like a thief. It robs you of everything.
It does.
It's the personality. It takes the person, takes the world away from the person.
I know.
And then it robs you if you're a caregiver. So
right.
It's really something that I'm praying that they get a cure for this, or get some testing that we would know and be able to have some medications or some things to do to,
yes.
To be able to either deal with it or either cure it or deal with it.
Or deal with it, or be, prepared. And because it's really important to have a plan, even if you know you're going to get it. I mean, you need to know like the behaviors, and then what's going to happen down the road, and then what type of care the person's going to need, and how it's going to be paid for, and what all this care cost. And I mean, there's a lot.
It's a lot. Yeah. And because it's progressive,
yes.
And it could be for a long time. So that's a long time.
And it keeps changing. So you might be doing one thing, you might have one level of care, and that's fine. And then all of a sudden they get worse. Right. And then you need a different level of care. And then you have to figure out, who's going to provide the care, how much it's going to cost, I mean, do I have the right type of insurance? It's just, it goes on and on and on.
Yeah.
We just need to be advocates for our health, whatever it is. I think we need to start not looking at the doctor as being this God who knows everything. I mean, they're human beings too. And I think we have to ask questions. So I just want people to advocate for their health at whatever age, ask questions, be informed, and take care of yourself too. And self-care is really important. So, this might be something like a topic that children that have parents that are in their 70s and, 80s should just look into, just to
absolutely,
just to be a step ahead of this if it were to happen.
Absolutely. That is the whole purpose of Autumn is Here. It is to get people and their families involved in their aging parents' life, so they'll understand things, so they'll learn about the medical history, even ask questions like that, so about the medical history of your family, and understand and have their business and their insurance and all kinds of different things, and know about things that affect them or may affect them later. Because you may become their caregiver. So you need to understand what's going on. So,
And you really need to know, for parents that have worked jobs for years, and maybe been a part of unions, make sure that make sure that the parents are aware that maybe, make sure that the beneficiaries are up to date and there aren't someone who has passed away. Maybe when you started working, you put your mom's and your dad down as beneficiaries and of your life insurance policy, and they've both died, they've passed away, and you haven't updated the policy, so just make sure all our paperwork is in order. I mean, all that is so important.
Yes, absolutely. Absolutely. Well, thank you so much. Thank you so much for this information. We appreciate it. And I'm sure it'll help somebody. And I know that you do research, so we're going to come back to you about research in genes and what's happening now that is going to help people in the future.
Oh, great. That was, because we really need to, as I mentioned, be involved in research studies. And we have one that's pretty exciting going on at Columbia, a genetic research study for African Americans and Hispanics. It's an international study, and I'm really excited about coming back and talking about that too. So
great. Well, we need to know that. So thank you. I can't wait because I need to know. I need to know more about that also.
Yes, because we need to make sure that when we're at the age that we're at, when we're at the age where we're at a higher risk, or rate of developing dementia, that there's some help out there for us. There's testing, there's treatments, there's, more information that there is available to us than there is now. So, it's important.
Yes, it is. Okay. Well, thank you so much for your time, and thank you so much for all the information that you gave. And I look forward
to helpful.
Oh, absolutely. And we look forward to interviewing you again. Okay.
Oh, wonderful. I look forward to it as well.
All right. Thank you. Have a good evening.
Okay, you too.